Hi everyone and welcome to the Suraj effect. Have you ever imagined a world where we could send tiny microscopic doctors inside our bodies to fight diseases right at the source? A world where treating cancer doesn't mean harming healthy cells and where medicines are delivered with the precision of surgeon's scalpel. Well, that world is not science fiction anymore. It's the incredible reality of nanomedicine. Now I know what you might be thinking. Nano, isn't that something to do with that small car? Well, you are not wrong about the small part. But in science, nano refers to something incredibly tiny. Imagine a single strand of your hair. Now imagine something 1,000 times thinner than that. We are talking about the nanoscale, a world invisible to the naked eye. And in this world, scientists are building revolutionary tools to transform healthcare. So how does it work? Think of it like this. You want to send a package to a friend in a crowded city. You could just throw it in the general direction and hope it reaches them, right? That's how many traditional medicines work. They spread throughout your body, affecting both good cells and the bad. But what if you had a super smart delivery service? One that knows your friend's exact address, avoids all the traffic and delivers the package right into their hands without disturbing anyone else. That's the magic of nanomedicine in drug delivery. Scientists have created different kinds of these nano delivery agents or nanocarriers. Let's look at few of the superstars. First up, we have the liposomes. Think of them as tiny hollow balls made of fat similar to our own cell membranes. We can pack drugs inside these balls. Their fatty outer layer helps them to travel throughout the bloodstream and deliver their cargo directly into the cells. Indian scientists are actively exploring the use of liposomes for delivering anti-cancer and antifungal drugs. Then there are the polymeric nanoparticles. These are made from biodegradable polymers which are long, repeating chains of molecules. Imagine a tiny, tightly wound ball of yarn with the medicine tucked safely inside. These nanoparticles can be designed to release the drug slowly over time, which means fewer doses for the patient. And here's a really cool one, dendrimers. The name comes from the Greek word dendron, meaning tree. And that's exactly what they look like. Tiny man-made molecules with a core and many branches. We can attach drug molecules to these branches. Their unique structure allows them to carry multiple drugs molecules and even imaging agents, helping doctors to both treat and see the disease. Now you might be wondering, this all sounds great, but is it happening in India? And the answer is a resounding yes. Our country is a hotbed of nanomedicine research. Institutes like the Indian Institute of Technology, the Indian Institute of Science in Bangalore, and the All India Institute of Medical Sciences are at the forefront of this revolution. They are developing nanomedicine solutions for some of the biggest health challenges we face. Take cancer for instance. Traditional chemotherapy can be very harsh, but researchers in India are developing nanoparticles that can specifically target cancer cells, leaving healthy cells unharmed. This can lead to more effective treatments with fewer side effects. What about diseases like tuberculosis? India has a high burden of TB and treatment can be long and difficult. Nanomedicine offers hope by delivering drugs directly to the infected cells in the lungs, making the treatment more potent and potentially shorter. Even for a disease like Kala-azar or visceral leishmaniasis, which affects the many in states like Bihar, nanomedicine is making a difference. An Indian company has developed a liposomal formulation of drug called amphotericin B. This nano formulation is much safer and more effective than the conventional drug. Of course, the journey is not without its challenges. Making these nanoparticles is complex and expensive, and we need to ensure they are completely safe for the human body. But our brilliant Indian scientists are working tirelessly to overcome these hurdles. Scientists like Professor A.K. Ganguly at IIT Delhi and his team have been doing pioneering work in the synthesis of various nanomaterials for healthcare applications. Researchers at the Institute of Nanoscience and Technology in Mohali are developing nanocarriers for treating various diseases, including cancer and diabetes. These are just a couple of examples of the incredible talent driving nanomedicine forward in our nation. The future of nanomedicine is incredibly exciting. Imagine a future where a simple injection can release a fleet of nanobots to repair damaged tissue, or where smart pills travel to the exact point of infection and release antibiotics. So the next time you hear the word nano, don't just think of a small car. Think of tiny troubleshooter, the microscopic marvels that are set to revolutionize medicine and create healthier India for all of us. That's all the time we have for today on the Suraj Effect. Join us next time as we explore another exciting frontier of science. Until then, stay curious.